A patient comes to the emergency room with breathlessness, another patient comes to your OPD with swollen legs, and the third patient comes with the history of orthopnea. Different presentations, but same diagnosis, that is heart failure. But the important question is what caused this heart failure in each of these cases. Treating heart failure without knowing the cause is like treating fever without knowing the infection. So friends, in today's video, I am going to discuss with you 5 important and the common causes of heart failure. And in this video, we are going to see what is the mechanism and the clinical clues in each of these causes. So friends, today's video is very important. You see this video till the end. And if you have come for the first time on this channel, then do subscribe this channel for more such clinical knowledge. So friends, without wasting much time, let's start the video. So first we will see what is heart failure. Heart failure is not a disease, but it is a clinical syndrome. This is important. It is a clinical syndrome resulting from the inability of the heart to pump sufficient blood to meet the body's demand. This is the definition of heart failure. And the common presentations of heart failure are breathlessness, fatigue, leg swelling, orthopnea, and PND, that is paroxysmal nocturnal dyspnea. Now we go to the different causes of heart failure. Now the most common cause of heart failure worldwide is coronary artery disease. Now what is the mechanism of heart failure in coronary artery disease? So the myocardial infarction, it causes a scar tissue in the left ventricle, and this scar tissue, it does not contract, which ultimately decrease the cardiac output and which then causes cardiac failure. Now, what are the important clues in heart failure due to coronary artery disease? So, the first clue is that the patient will be of middle age or elderly. So, any patient of heart failure who is middle age or elderly, you will first think of coronary artery disease. There will be history of previous myocardial infarction. If there is no history of previous MI, then there may be a history of angina. Patient may also give history of previous angioplasty or CABG surgery. In ECGs, you will get a Q waves, and these Q waves, they indicate old infarction. And in 2D echo, you will get regional wall motion abnormalities. So these are the clues for knowing if the cause of the heart failure is coronary artery disease. Then the second cause of heart failure could be hypertension. This is the cause that is rarely noticed, or mostly it goes unnoticed. Now, what is the mechanism of heart failure in hypertension? In hypertension, there is increase in the afterload, so the heart has to contract against the pressure, and as a result, the left ventricle, the thickness of the left ventricular wall, it increases and it causes, like it looks like this, and it is called as left ventricular hypertrophy. Now, what happens in left ventricular hypertrophy? Here, the systolic function or the contractility of heart is normal. That is, the ejection fraction is normal, but the relaxation of heart is improper. That is, there is diastolic dysfunction. And here, the heart failure that occurs is called as heart failure with preserved ejection fraction. So this is the mechanism of heart failure in hypertension. Now, what are the clues for knowing if hypertension is the cause? Here also the patient will be elderly. Here there will be a long history of hypertension, and there will be a history of poor BP control. And in ECG, you will get the signs of left ventricular hypertrophy, and you will get diastolic dysfunction. You can detect it in 2D echo. So in this way, this is the second important cause of heart failure, that is hypertension. Now, the third common cause of heart failure is dilated cardiomyopathy. Now, the mechanism is that the musculature of the left ventricle becomes weak. As a result, it becomes dilated. This is the size of a normal left ventricle, and here you can see in dilated cardiomyopathy, the left ventricle has become dilated. As a result, the ejection fraction or the contractility of the heart reduces, which ultimately leads to heart failure. Now, what are the clues? Here you will have a young patient. So, if you get heart failure and the patient is young, then you will first think of cardiomyopathy. Here you will have a history of progressive breathlessness. In 2D echo, you will have a markedly reduced ejection fraction and there will also be dilated chambers. So, this is the dilated cardiomyopathy. Now, the fourth cause of heart failure is valvular heart diseases. Now, what is the mechanism here? The mechanism is that depending upon the valvular disease, there can be increase in the pressure or there can be pressure overload or there can be increase in the volume or there can be volume overload. So the common conditions where there can be heart failure are like mitral regurgitation, aortic regurgitation, aortic stenosis, rheumatic heart disease. So this is the mechanism of failure in valvular heart disease. Now, what are the clues here? Here the patient will be either middle age or young patient. Important thing is that on auscultation you will get murmurs. So any patient with heart failure, never forget to auscultate the chest where you can get the murmur. Then there can be history of rheumatic fever and there can be various type of abnormalities in the echocardiogram depending upon the valvular heart disease. Now the last cause which is often forgotten is arrhythmias. Now the mechanism here is that for the proper pumping of the heart, a coordinated electrical activity is required and this is lost in arrhythmias, due to which there is improper filling of the heart and ultimately the ejection fraction of the heart is reduced, which leads to heart failure. The various arrhythmias which can lead to heart failure are like atrial fibrillation, ventricular tachycardias, complete heart block, and even persistent sinus tachycardia. They all can lead to heart failure. Now, what are the clues here? Here, the patient will give the history of palpitations, syncope, and irregular pulse. And here, ECG becomes very crucial because only from ECG you can determine what type of arrhythmia is there. Now, apart from these 5 important causes, there are also other causes of heart failure like congenital heart disease, myocarditis, CKD, anemia, thyroid diseases, alcohol, or even peripartum cardiomyopathy. Now we will see what are the important investigations that we have to do in heart failure. So the important investigation is ECG. Now from ECG we can get various type of clues, like here you can get the diagnosis of left ventricular hypertrophy. You can also get if a patient is having MI, and you can also detect various type of arrhythmias. So in this way ECG is very important. Then the second important investigation is 2D echo. From 2D echo you can get the important investigation of, you can get important finding, that is ejection fraction. Then you can see if there are any dilated chambers. You can also know if there are any valvular heart diseases. So in this way, ECG and 2D echo, these are the two most important investigations in heart failure. Apart from that, you can do certain blood tests. In blood test, you can get the hemoglobin, which will show if patient is having any anemia. You can also do thyroid test. And important blood test that is done in heart failure is NT-proBNP, which shows the it gives diagnosis of heart failure, and it can also show the severity of the heart failure. You can also do X-ray chest. Here you can get the cardiomegaly or the picture of pulmonary edema. So the important 5 take-home messages from today's video are that the coronary artery disease is the commonest cause of heart failure. Hypertension is a silent cause of heart failure and it leads to heart failure with preserved ejection fraction or diastolic dysfunction. If the patient is young, you will first think of cardiomyopathy as the cause of heart failure. And in any patient of heart failure, always try to listen for the murmurs. And echo is the most important investigation in the patient of heart failure. So next time you encounter a patient of heart failure, don't stop at the diagnosis. Ask this important question: what caused heart failure in this patient? It will make you a better clinician. So friends, I hope that today's video was helpful to you. If you find today's video useful, give it a like, share with your friends, and if you have come for the first time on this channel, then do subscribe this channel for more such clinical videos. See you in the next video. Till then, thank you.